Have you ever experienced a strange tingling sensation in your hands or feet, perhaps accompanied by numbness or even pain? Could it be a sign of a condition called peripheral neuropathy? This is more than a mere discomfort. It is a medical condition that involves the damage of our peripheral nervous system, the network that transmits information between our central nervous system and the rest of the body. Peripheral neuropathy is a surprisingly common affliction, affecting approximately 2% of the population. However, the prevalence increases with age, impacting around 8% of individuals over the age of 55. The most common culprit? Diabetes. But what does peripheral neuropathy feel like? Symptoms often kick off in the feet and can range from muscle weakness and decreased sensation to that strange tingling we mentioned earlier. In some cases, autonomic nerve dysfunction can also occur. In the next few minutes, we will delve into the world of peripheral neuropathy, unraveling its causes, symptoms, and possible treatments. So let's embark on this journey together as we shed light on this often overlooked yet significant health condition. So, what exactly causes this peripheral neuropathy, you may be asking? The primary contributing factor, as it turns out, is diabetes. In fact, peripheral neuropathy is so closely linked to diabetes that it's the most common cause of the condition. You see, high blood sugar levels can damage nerves over time, leading to peripheral neuropathy. That's why maintaining normal blood sugar levels is crucial in preventing this type of neuropathy. But it's not just diabetes. There are other potential causes that could put you at risk for this nerve disorder. For instance, some types of autoimmune diseases, such as lupus and rheumatoid arthritis, can lead to inflammation of the nerves, causing peripheral neuropathy. Infections too can play a role. Certain viral or bacterial infections like Lyme disease or shingles can attack nerve tissues and cause peripheral neuropathy. We can't ignore the role of genetics either. Some people are simply born with a higher predisposition to developing peripheral neuropathy due to inherited disorders. Furthermore, exposure to toxins or heavy metals such as lead or mercury can also lead to nerve damage, resulting in peripheral neuropathy. And then there are certain medications, especially those used for treating cancer, which have been found to cause peripheral neuropathy as a side effect. It's also worth noting that in some cases, the cause of peripheral neuropathy remains unknown. This is often referred to as idiopathic neuropathy. Each of these factors alone or in combination can lead to peripheral neuropathy. It's a complex condition with a multitude of potential sources. But don't despair. Understanding the causes is the first step towards managing this condition. Up next, we will explore the symptoms of peripheral neuropathy. Now that we know the causes, what are the signs that one may be suffering from peripheral neuropathy? Well, peripheral neuropathy often sneaks up, starting subtly and gradually. The first place it usually makes its presence known is in the feet. You might notice a slight numbness or tingling, almost as if your foot has fallen asleep. This can be easy to dismiss. After all, who hasn't experienced a foot falling asleep now and then? But with peripheral neuropathy, the sensation persists. Over time, these initial tingling sensations can develop into more persistent issues, like muscle weakness. You may find yourself stumbling or struggling with tasks that once seemed easy. The strength you once took for granted in your legs might seem to be slipping away. This can be quite alarming, but remember, it's an important sign that something may be going on with your peripheral nervous system. Along with weakness, numbness is another common symptom. This isn't just an absence of sensation, rather it can feel like a layer of cotton is wrapped around your feet or hands, dulling your sense of touch. Imagine trying to pick up a coin, button a shirt, or even just feel the texture of a loved one's hand, but that familiar sense of touch is dimmed or even gone entirely. This can be one of the more distressing symptoms of peripheral neuropathy, as it affects the way you interact with the world around you. Decreased sensation is another common symptom. This can manifest as an inability to feel pain or changes in temperature. Imagine stepping into a hot bath and not being able to feel the heat or not noticing a cut on your foot. This lack of sensation can be dangerous, as it leaves you vulnerable to injuries you may not even be aware of. It's also worth noting that the symptoms of peripheral neuropathy aren't always physical. The condition can also affect the autonomic nerves, which control functions like blood pressure, heart rate, digestion, and bladder function. So you might experience symptoms like dizziness, constipation, or urinary problems. In summary, while the symptoms of peripheral neuropathy can vary greatly from person to person, the most common ones are muscle weakness, tingling, numbness, and decreased sensation, typically starting in the feet. It's important to know these symptoms to catch the condition early. Next, let's talk about how peripheral neuropathy is diagnosed. How does a doctor determine if you have peripheral neuropathy? This is where we wade into the waters of diagnostics, a critical step in the journey to managing this condition. To diagnose peripheral neuropathy, a comprehensive approach is required. One that involves a medical history review, a physical examination, and possibly blood tests and nerve conduction studies. Let's break down this process, shall we? First off, your doctor will delve into your medical history. It's like reading a book, really, where each chapter unveils a part of your health journey. They'll want to know if you've had any previous medical conditions or if you've been exposed to factors that might contribute to nerve damage. For instance, a history of diabetes, alcohol abuse, or exposure to certain medications or toxins could be relevant pieces of the puzzle. Next, a physical examination is in order. Your doctor is now the detective looking for clues in every corner of your body. They'll check your muscle strength, your tendon reflexes, and your sensitivity to touch and vibration. Remember, peripheral neuropathy often starts in the feet, so don't be startled if your doctor pays particular attention to these extremities. But the investigation doesn't stop there. If the clues gathered thus far point towards peripheral neuropathy, your doctor might order some laboratory tests. Blood tests can reveal vitamin deficiencies, metabolic problems, or signs of autoimmune diseases, each of which could be the culprit behind peripheral neuropathy. Last but not least, we have nerve conduction studies. If you're picturing a miniature train speeding along your nerves, well, you're not entirely off the mark. During these tests, small electrodes are placed on your skin and a tiny electric current is passed through your nerves. This allows your doctor to measure the speed and strength of signals traveling through your nerves. Slower or weaker signals might be indicative of peripheral neuropathy. In some cases, the doctor might also recommend a nerve biopsy, where a small sample of your nerve is removed for further examination. This step is usually reserved for cases where the cause of the neuropathy remains elusive. Diagnosis is key to initiating appropriate treatment. Speaking of which, let's delve into the treatment options for peripheral neuropathy. So, you've been diagnosed with peripheral neuropathy. What next, you may ask? Well, the journey towards managing this condition is multifaceted and tailored to suit each individual's unique situation. One thing to note is that there's no one-size-fits-all solution, but there are several treatment options available. The cornerstone of treating peripheral neuropathy is addressing the underlying cause. Think of it like a leaking tap. It's not enough to mop up the water, you've got to fix the faucet. If diabetes is the root cause, for instance, maintaining optimal blood sugar levels becomes pivotal. This involves a combination of dietary changes, regular exercise, and possibly medication. If the cause is linked to a vitamin deficiency, the remedy might be as simple as nutritional supplements. For those cases caused by certain medications or alcohol, it might require lifestyle changes, such as discontinuing the medication under a doctor's guidance or abstaining from alcohol. Now, while addressing the root cause, it's equally essential to manage the symptoms. This is where medications come into play. Over-the-counter pain relievers, topical treatments, certain antidepressants, and even some anti-seizure drugs have been found effective in easing the discomfort associated with peripheral neuropathy. But remember, every medication has its potential side effects, so it's crucial to discuss these with your healthcare provider. In some instances, therapies and procedures might be recommended. Physical therapy can help improve mobility, while transcutaneous electrical nerve stimulation, a technique that involves sending low-level electrical currents through the skin, can be beneficial for certain types of nerve pain. Moreover, it's worth noting that treatment for peripheral neuropathy isn't just about medication and physical therapies. It also involves emotional and psychological support. Living with chronic pain can be challenging, and it can take a toll on one's mental health. Support groups, counseling, and stress management techniques can all play a role in helping individuals cope with the condition. And let's not forget the importance of self-care in managing peripheral neuropathy. Regular exercise, a balanced diet, and adequate sleep can all contribute to overall well-being and potentially help alleviate symptoms. Lastly, remember that research is ongoing and new treatments are being developed. So stay in touch with your healthcare provider, keep abreast of the latest research, and don't be afraid to ask questions or seek second opinions. With the right treatment and lifestyle changes, managing peripheral neuropathy can be achievable. The journey may seem daunting, but with a proactive approach and the right support, you can navigate the path towards managing this condition, one step at a time. Peripheral neuropathy might sound daunting, but knowledge is power. We've journeyed through the intricacies of this condition, understanding its causes, symptoms, diagnosis, and treatment. It's a condition that affects a significant number of individuals, particularly those over the age of 55, and is most commonly caused by diabetes. We've discovered that the symptoms of peripheral neuropathy often start in the feet, manifesting as muscle weakness, tingling, numbness, and decreased sensation. It's essential to be aware of these signs, as early detection can significantly influence the management and potential reversal of the condition. In diagnosing peripheral neuropathy, we've learned that a comprehensive approach is adopted. A detailed medical history, a thorough physical examination, and in some cases, blood tests and nerve conduction studies are employed to get to the root of the issue. Of course, treatment focuses on addressing the underlying cause. If diabetes is at play, maintaining normal blood sugar levels is paramount. Medications may also be used to manage the symptoms, providing a much-needed relief to those affected by this condition. In conclusion, while peripheral neuropathy is indeed a challenging condition, there's a wealth of knowledge and resources available to help manage it effectively. That's where the power lies, in the ability to understand, detect, manage, and potentially reverse the effects of this condition. We encourage you to learn more about peripheral neuropathy and take proactive steps to manage your health. Remember, your health is in your hands.